Hi, everyone. Welcome to OrthoPod. My name is Mo Bendari, as you know, Editor-in-Chief of Ortho Evidence. I'm here today with a friend and colleague, Dr. Nina Ahuja, who is an ophthalmic surgeon, the academic head of the Division of Ophthalmology at McMaster University, and currently serves as an associate professor there as well. She is founder of Docs in Leadership, and most importantly, I have her here today to chat with us in the orthopedic surgical community about stress in medicine. Welcome, Nina.
Thank you, Mo, very much for having me.
So I had the pleasure of getting an advanced copy of your book and reading it. And it was really a very easy flow read. And the 200 or so pages fly by. So you can actually do the read in a single sitting, which is good. I think for most of us, when we're looking to read, it's really good. I want to start, if I could, with what I found was a profound final statement or near final statement. And you start off, I think I'll paraphrase it, but you say, I encourage you to challenge the culture of silence within medicine. And I wonder what you mean by that. And I wonder if that might be an opening statement to really what this book is about.
Mm-hmm. The final statement I thought a lot about actually when writing the book. The book in itself is something that I am very passionate about because I do feel that stress is very high in medicine, and it's something that we're brought into when we actually start engaging right from medical education. The idea that we're in a competitive environment, we're reared in a competitive environment, and as a result of that, there's often hesitation to share experiences and challenges that we face, whether they be personal or professional. Because of the nature of our profession, it's very unique. We're often exposed to different experiences that other people are not, and it's emotionally intense in many ways. And so the idea of that statement was to encourage people to be open about the challenges they face so that at least we can support one another as colleagues who can understand the unique context. The book presents that idea and also a framework by which we can start thinking about our challenges and addressing them in a way that is more organized, because I feel that as physicians and surgeons, we all have very structured minds. And so sometimes when dealing with challenges, it's nice to have a framework to work within. So within the book, I present 5 phases of experience, which in my experience have been where my challenges have rooted. And so within that, I explore the different factors that we can think about to help manage those situations, depending on the phase of challenge that we're finding ourselves in. So that's the essence of the book. And the final statement is to encourage people to share their challenges. I've been very transparent and open, as you know, having read the book, about some of my own. And so the spirit of that was to lend that experience to other people as encouragement to do it themselves, so we can actually start helping and actively supporting each other more openly.
Well, I mean, first of all, that's great, because my question was going to be, who do you think this book is ideally suited for? I get the impression I have the answer, but I'd love to hear it from you.
My impression is that it's open to any health professional. Anyone who's in medicine can relate to the context. It's written from a physician perspective, speaking to fellow physicians. But I feel that the true audience is the learners, the medical students, residents, people in the first 5 years of career, simply because even if we look at the Canadian Medical Association Physician Health Survey that was conducted in 2017, the higher incidences of concerns with wellness did come in those categories. And so it is across the board, of course, for people who've been in practice as well. But my thought was actually that if we can present these tools to people earlier on in their careers, that it's something they can carry with them throughout, in addition to more seasoned people as well, hopefully getting something out of it.
So I also noted that in your introduction, you really referenced COVID-19, which made me think this book has been very recently constructed, or at least you've been thinking about it, I'm sure, for many years, and we'll get to the storyline. But certainly, you have been, it's fairly current in at least in what your current thoughts are. And if I could, you talk, I'll throw the quote right from the book, and then I'll share with you something that resonated with me almost perfectly for the last several months, which is, I think you put, when COVID-19 hit or something to that effect, your usual routine as well as many of ours was forced to stop. And you wrote, I had time to thoughtfully consider my journey, where I was, how I got there, and how I wish to proceed. Now that is pretty well almost parallel to a quote I've been using by another group of individuals, which says the same thing. And I probably used that quote in the last 40 lectures I've given, no joke, as my opening slide. And I'll read that to you because it resonates with me as well. And I'm wondering if you could speak a little bit to, the process of writing the book and why now was the right time to put it out. But when it comes to accelerating performance, there's a paradox. If you want to have greater impact faster, sometimes we have to slow down enough to reflect on what we've done and where we're going. I look at COVID-19 as being that global pause button for all of us. And when you look at surgeons, at least in our communities, there was a 70% decline in your usual day-to-day activities if it was work-related. So how did we fill that time? There was a ton of individuals who were really uncomfortable, and I would use the word stress being part of that. And there's another group of people that were reflective and able to also accomplish things. And then there was this, but there wasn't one pervasive viewpoint happening. And I'm wondering for you, how this last several months, this slowdown has allowed you to think about the concepts in the book, or were these concepts already completely solidified and you were just basically now putting them on print?
The COVID closure for me was definitely a time of reflection, as I mentioned in the book. The concepts of this book came out of that reflection, actually. My office was closed from March 15th, and initially we were dealing with, as you would know, a lot of the issues academically for our residents and deciding how we're going to be doing things in that regard for curriculum and examinations, etc. During that time, as I was interacting with our residents and just in general looking at different posts to see what other institutions were doing, it really resonated with me that the residents and medical students were all in a level of stress that is unlike what we faced when we were going through medical school, which is stressful enough, in residency as well, simply because of all of the uncertainty associated with it. That really brought me back to my time, and I struggled through medical school. It was not an easy journey for me. And so it struck me that this is the first time I've got an extended period to actually work on a project. I've always loved writing. And so these are concepts I've been thinking about for many years. And it just so happened I was going for a walk one day and the framework hit me. So I actually had thought a lot about how, the different challenges have hit me in various phases. And then when I was thinking about the framework, I was on a walk with my husband actually, and we were chatting, and this came to mind, and I said, this actually applies. It's a bit of a pun in certain ways. The framework is called admit, and so we admit patients, but it's also encouraging us to admit what we're experiencing. So it actually came about rather quickly, where the concepts and ideas had been brewing, but I hadn't really thought to put it together until this period came about. So with that, sorry.
No, go ahead.
So with that, I started writing. I put together an outline, and it all just started to flow, and it just came out, and I was able to connect with the right people to make it happen in a very short time frame, which was amazing on the people that I'm working with. They're quite remarkable in being able to push something like this through. And I was very hopeful that this would come out in 2020 because it is so timely, and so the COVID certainly has heightened the stress level of everyone in medicine and even beyond that.
Yeah, funny, there's a bunch of things that I will reflect back on the things I talk about, but I've used another quote a lot, which is called saying isn't doing, doing is doing. I see the D part of your admit as being doing. And there's a lot of people might have ideas, but very few actually take them to that next level. So, from the perspective of action, I think you in many ways manifest what many of us wish we can do, is take the opportunity and be aggressive with that, or efficient with that time that we have. Let me, if I could, just ask you broadly, because the book is about stress. How does stress, in your mind, manifest itself? Like, so when you're, whether you're a trainee or whether you're later in practice, what is stress, or what are the features that would alert someone that things aren't right?
I think there are a few things. Number one is a general feeling of being overwhelmed, where you lose clarity in what you're trying to actively work on, where the small things tend to become bigger issues, where in another time period, it would have just and like rolled off your back type of idea. There's that component. There are three different components really. There's the psychological component, there's the physical component, and then there's the cognitive component. So depending on how you manifest, I think that varies in everybody, and you need to learn to identify what that is for you. So as I mentioned, from a cognitive standpoint, can be the feeling of overwhelm where you can't make decisions, you can't proceed with things or process the information as you normally would. From a psychological standpoint, there can be the emotional manifestations of feeling depressed or irritated, for example, or just generally a physical unwellness, which is the physical aspect where you can get headaches, nausea, just a feeling of fatigue that can be overwhelming. Those are factors I think that are things we can identify on our own self-reflection, which is something that I emphasize in the book as well, so that you can recognize these things as flags and then know that this is a moment to take a pause and really try to see how best to manage the circumstance.
I also noted that you put some emphasis, to some degree anyways, on being able to recognize your own personality traits. And I think it was something along the lines of, using, that spectrum between being extrovert to an introvert, and saying, if you're aware of it, you have even more power to be able to reflect on what it means and how one might react. Can you speak a little bit about the issue of, how your personality may influence how you react to some of these stressors?
So I speak about that personality aspect from the perspective of how do we seek support. So for introverts, I'm more introverted by nature. We tend to go inward and not really discuss our feelings openly or our challenges very openly. That's just the tendency we have, because the go-to is to go inward and think about the different issues that are arising, the different perspectives that are arising, and then try to come up with a solution from there. And that's in contrast to the extrovert, where they're very chatty more often, willing to reach out to other people, and as a result of that, they're more likely to seek support. The idea of being aware of where you fall on that spectrum is that, for myself, for example, if I tend to go inward, I can't, number one, get perspectives from other people who may have something valuable to contribute. The other is I can't seek emotional support just by unloading the burden, where they say, a problem shared is a problem lessened. And also the idea that when you're able to engage and express with other people, there's a connectedness that can come about that can counter a feeling of isolation that you may otherwise feel, just by the nature of the fact that you're introverted. From the extroversion standpoint, there is the benefit that you're likely to reach out, as I mentioned before. You are going to be more likely to get those external perspectives, assuming you have the ability to listen as well. A lot of extroverts like to talk and forget to listen sometimes. But the idea with that is that where the introvert often sits quietly and reflects, the extrovert may not have that. And so in order to develop that inner awareness of where those roots of reaction are, what your stress manifests like, you do need to have that period of quiet reflection. And so if you're more extroverted in nature, it's valuable to reflect, do I take that time to actually think about the issues from different perspectives within my own mind, in addition to seeking the external support.
Yeah, and I noticed a lot about mindfulness, reflection, meditation, at least maybe not worded always in those ways, but really taking a moment, a pause, getting out, going for a walk, if you're a cyclist, cycle, whatever it takes to get in your mind, but taking time to just let, things settle. I found that personally quite helpful, whether it's a ride or a walk. I find those really helpful. And it's interesting that when you said you have ideas come, often I've always said it this way, Nina. I've always thought that, we all have lots of great ideas, but they're also drowned out by the sound of noise in our head through our daily lives. And if you can quiet the sound, some of the great ideas can actually be heard. And so when you're walking, or you're riding, or you're just reflecting, staring out into a beautiful, whether it's a sunset or a lake, I found I have way more reflections that are helpful to me for actionable things in my life, rather than sort of the day-to-day grind. I wonder if you could speak a little bit more to the statement you make is, what would it be like if we just lived in the present moment? So not worried about the past, not worried about the future, and how does one actually achieve that?
That I think is challenging for people in general, and I think for us as physicians, simply because we've got so many responsibilities. We're always being pulled in different directions, whether it be work-related, family-related, or otherwise. And so to be able to stop and be still is challenging simply because there is so much that needs to be addressed in a day. My feeling for myself is that it's important to do that, and I find the most effective time for me to do that is actually at the end of the day, where whether I'm taking a few moments in a quiet room at home or just laying in bed and just listening to the silence around me. That's how I'm able to get centered into that moment. So we do have all of the ambient sounds around us, and we've got the sounds going on in our minds as well. But I once read a book where they suggested if you just try to listen to the silence, actively listen to the silence below all of those sounds or beneath all of those sounds, it can actually serve to center you. That process, coupled with deep breathing, and I do mention that in the book, that allows me to clear my mind. And then the act of allowing that clearance to happen creates space and room for other feelings to come up. So I find the thoughts don't stop, but it creates room for those inner messages that I need to pay attention to. It's difficult to do, and it took me a while to develop the skill to be able to do that, to be quite honest with you.
Oh, yeah.
Many months, perhaps years even.
I'm still trying. So
so it's not, and I'm not quite 100% there yet.
Mm-hmm.
Still is a challenge.
Yeah.
But there's definitely value in it. And I've always believed that things come to us in the time that we need to hear them. Experiences come when we have to have them.
Right.
And so long as we're open to the lessons in those moments and we're willing to listen to ourselves and how we're processing it, we can always get something out of it if we're maintaining that open mind.
And then that gets me really to the crux of some of the clear strategies that you suggest we use. But it starts around the storyline of change, right? Change is really hard, and whether you're leading change or whether you're participating in change, that's usually when we see. When I say we proverbially, but that's usually when I've seen, stress manifests itself at high levels. So COVID represented a major shift in the way we all live. So I think all of us, for the first time in the world, I think, have felt something the same way. And I always say that developed nations are finally hearing what the low middle income countries have been sirening for years, which is healthcare is not a privilege, it's a right. And so we're all feeling that for the first time. And you see different ways in which we either cope or adapt, and some don't do either, unfortunately. I wonder if you could speak a little bit about to change, and then maybe speak a little bit about the overall acronym, which is ADMIT, and how that actually plays in. So how does that practically now help somebody going through what would be considered a change, a big change, whatever that may be? Right now we're in COVID, but I suspect this applies to any major shift.
Mm-hmm. I agree that change really is the root of a lot of stresses, and change happens, in various ways in our lives. COVID certainly, as you mentioned, is a prime example of that. The ADMIT framework, and I'll relate it back, I also think that this is also connected to integrative thinking, where you can actually take a situation that does not seem very positive and then flip it and make it a new opportunity. So the ADMIT framework ties both to change management, I think, and integrative thinking models. A stands for adapting to new ways. So the idea is that when we're presented with a new situation, challenge, circumstance, or process, it's hard to adapt to that because we're so set in our ways. And so the idea is, what are some of the barriers that we need to overcome to help allow ourselves to simply be open to considering a new idea? And the book speaks about concepts of locus of control, for example, and how you view the world. D is for doing the work. That addresses the idea that we are pulled in multiple directions. And so how do you manage those circumstances where you feel like you have 100 things to do, you've got limited time to do it? What are the barriers and challenges that we can explore within ourselves to help address those concerns? M is about measuring success. we're raised in a competitive environment, or we're reared in a competitive environment in medicine. We're getting into medical school, residency, positions. We're always competing with others. And our evaluations are rooted in external measures of success. So how we do on exams, how we do on clinical rotations, it's always based on what the other is saying. And so the idea is that while that's important because we need to maintain standards of various sorts, how do we not internalize that so that that becomes how we define, so that the external measures of success are not how we define ourselves, so that we can move beyond that into the internal measures of success, so that while those external measures are cause for stress, it doesn't shake us to our very core if something were to inadvertently be a disappointment or not go as well as we'd anticipated. I is for introspection, and that talks about the mindfulness idea and just taking that time to see what emotions come up when we're in different situations. Try to consider those emotions within a framework of emotional intelligence, which I also talk about in the book, and then see how we can learn more about our reactions and then modify our responses to make the stress levels more manageable. And then T is about transformation. The idea that, having gone through different phases of experience and having considered the different elements and how one can modify and process things in a way that would be more productive or conducive to lowering stress levels and still being productive, how can you then incorporate that into your being as you move forward, so that each stage offers thoughts to consider and concepts to consider, so that when you come out of that situation or that challenge, there's actually been some real learning, which then incorporates into who you are and therefore causes a transformation to your next version of yourself.
Oh, that's superb. And I guess the book, as I saw, goes into each of those in some degree of detail. So it allows you to kind of reflect on each of those points as you go forward. The one thing that struck me too is I've done a little bit of reading around, mindsets and growth versus a fixed mindset. Carol Dweck was a scientist who talked about this, which really resonated in some of the things you're saying. Is that so much of it is if you believe that you're doomed, or you already believe you can't change, then it'll be very difficult to change. And I think you make that point as well, that you have to have an openness to change to even start on that journey, and whatever that looks like, and how you build in those sort of your own supports along the way. I wonder if you could, Nina, if you were to give any words of advice to a medical student, a trainee, a resident in orthopedics and surgery, any of the disciplines, or even a faculty member who right now may watch, may listen, and is feeling overwhelmed by the situation, what should be their first act? What should they do at this point? Obviously, I think it's facetiously, they should read your book. I think that's a really good one. That's it's a great first start. But if you were to give advice as someone who's really lived this, what would that be for people?
I think the biggest thing to keep in mind, and my dad has said this to my brother and I repeatedly, wherever there's a problem, there is a solution. You just have to be patient and willing to find it. So I think keeping that in mind is a good premise, because it sets up the mindset, as you just mentioned, in a way that allows opportunity to come to you and the hope of resolution. So I would say keep that in mind. And then moving forward from that, if you do read the book, just look and think about the concepts in those various phases of experience. Try to identify, what is it about that particular challenge that you're struggling with? Is it the idea that you just don't want to accept the idea and you think it's a bad one and you're not open to it? Or is it just, the idea that you've got so many things to do and it's just one more thing? Or you disagree with what the outcome needs to be, or what that outcome should look like. And moving on, continuing from that, emotionally, do you feel like you're just not able to manage the additional stress for whatever reason? And then, are you willing to do it? Are you willing to go forth with the change and change your mindset? So I think really thinking about what is the barrier along the path to managing that challenge, and then moving forward with the idea that if there is a problem, there's a solution. We just have to be willing to, find it, look for it and find it.
On that note, I can't thank you enough, Dr. Nina Ahuja, for spending some time with us today at Orthopod. and giving us some salient advice about what we can do to manage stress and, more importantly, the actions we can take within to help cope in a very, very difficult time. Thank you so much for your time.